we're going to start to transition a little bit here and start moving into our conversation around the CMS requirements, the 17 provider types, moving into our work group session this afternoon. So just a couple slides to kind of help us with that transition. As we all know, 17 provider types are identified in the CMS rules, of which most, if not all, of everybody in here is under one of those 17 groups. And if you're not, you probably work very closely with 1, 2, or all 17 of them. So keep that in mind. As you looked at the general overview of the CMS rules, really focused on these things. Making sure the facilities have emergency plans. Making sure that the facilities have their policies and procedures of how to implement those plans. And a lot of that is not only internal facility procedures, policies, procedures, and planning. It's how are you as a facility going to support the region as a whole? So how do we work together in a response type of activity? So we've kind of been focusing on those two areas over the last few meetings, talking about emergency planning, talking about policies and procedures, and providing opportunities for you all to share what you've developed, ask questions, and integrate those questions. And then the communications piece is kind of where we're at. So we want to spend some time today talking about that communication piece. But as we look at that, this is a slide that we've shared before. If you want a copy of this, we also have that with the documentation in the back room. It's just a list of different resources that we have here at the regional level that we've collected and have access to for you to use as you look at meeting your requirements around those CMS deliverables. So it's just a guideline that lists the different toolkits that we have, the different policies and procedures we have, the situational awareness, different things that are out there that you can take access to help in your work. So now as we start to move into the communication plan piece, I'd like to introduce Daryl Ruby and Ken Mitchell, who are going to come up, and I guess Dean is not part of this today, wasn't able to make it. So Ken and Daryl are going to work through some work that they have done with hospital communications planning. You can fight over.
So I'll go ahead and start. My name is Ken Mitchell. I am the Emergency Management and Safety Officer with Kootenai Health over in beautiful Coeur d'Alene, Idaho. And we wanted to talk to you really quickly about some communication requirements that may or may not be new to you, depending on what facility you have. So a few bullet points on what we need for communications. So names and contact info for all staff, LIPs and volunteers. Hopefully you guys have a human resources department. Hopefully that human resources department has that information. Contact info for sources of assistance and EM resources, primary and alternate means of communication, method for sharing information with other healthcare providers, a means to release information during an evacuation, provide information about patients, and also occupancies and needs and abilities, what have you. So we're going to kind of go through that piece by piece.
All right, so my name is Daryl Ruby. I'm the Emergency Manager for Providence Healthcare. We did also work closely with Dean Davis from Deaconess on this presentation. Unfortunately, he wasn't able to join us today. Kind of as an aside, it's been pretty neat since I joined Providence almost 2 years ago now. Ken got into the area 6 months ago, 9 months ago.
Yeah, about 6 months ago.
And so we've got a pretty good collaboration in Spokane, as well as in some of the outlying counties, but we've met together pretty regularly, had breakfast together sometimes, and we've been working together on some of these things, which has been very helpful to bounce ideas off each other. But you know, from a purely regulatory sense, which I really don't like the regulatory focus of hospitals, it looks really good. So the collaboration, I think, from the Healthcare Coalition, and just to kind of promote some of the stuff that Ed and Travis has talked about, these meetings, I think, are not only very beneficial. That's really, I hope, the best part of it. But it certainly will help you, I can promise you, with this new CMS rule. And as Ed showed that matrix, you know, make sure you have that in mind as the regulatory visits start coming, especially for those non-hospital entities. But some of the things specific to communications, and this is really communications related to your disaster plan, if you will. So for hospitals, one of the things I learned in this process is we've also got a pretty robust marketing communication or public information officer role. So this really is more focused on what do you need to do specific to communications during a disaster, but there's a few things that are called out and that you need to be mindful of. And it's, everything from the old-fashioned call tree, or maybe like many jurisdictions and organizations and agencies have access to these mass communication tools. For Providence, we're just in the process of implementing Everbridge as our mass communication tool. So Hannah, I did not know that you have experience with it, but I'm going to follow up with you because I'm learning a ton and a bit overwhelmed with it. And then, thank you. So, and then having some, communication and coordination with your HR team and the files that you have on your employees and things like that. But it's really just that internal communication piece for our hospitals and our healthcare organizations, and then the external coordination, similar to what we have here, but that will help us a lot in response as we respond collectively together.
Yeah, absolutely. And I would say, one of the biggest learnings that I've had on mass notification platforms like Everbridge is the need to determine the source of truth. So you have those people who, in their HR file, they joined your organization 38 years ago, and since then they might have got a cell phone, and that's probably not in their HR file. So really look at that source of truth and make sure that we have the correct way to contact our employees. So you also need to have sources of assistance and EM resources. The biggest piece for that is know your regional resources. Know who the person is that is at this agency or that agency, and know that if you need a ventilator, you can call this guy, and if you need sandbags, that was a big one when I was over on the west side of the state, you call that person. We have the Region 9 contact list that Travis, I think, put together. An excellent contact list. It's available online. I would say also print it out, put it in a binder, because as we experience, the website tends to go down for maintenance every now and then, and you keep frantically clicking on it and don't have it. Individual vendors, contractors, and suppliers. So really, whatever that means to you. With hospitals, we're looking at everything from fuel and med gas. Would probably be our two biggest ones. Daryl, is there another really big one?
Water.
Water, yeah, water's big for you guys. We have our own well, but yeah, water's a big one.
We had a little E. coli outbreak at the hospital, and I thought I understood how important water was, and I really learned how important water was in the hospital.
And then local and jurisdictional emergency management office, so GSEM, Windham County, Kootenai County, things like that. So you have that, point of contact where, this happened, and they can get you in touch with resources. I think, in my mind, the biggest one was right now we're going through a shortage in sodium bicarbonate, and we had a pretty rough meeting in my hospital, realizing we only have about 30 doses left, which is about enough for 3-ish days. And so that's when we, gave local emergency management a call, and then, they got a hold of Nick, and he kind of bailed us out. So make sure that you know who you need for that EM assistance.
Yeah, it really just reinforces, truly the strength of emergency management, and that really spans the healthcare coalition is the relationships. The blessing and the burden, the blessing and the curse, if you will, of emergency management is there's no real standards in emergency management, and that's where the relationships can really be helpful. The curse of that is we try to standardize things and align across multiple jurisdictions with multiple personalities, political and otherwise, it can get challenging. But in the big events, depending on where you're at locally, knowing your healthcare system, knowing your partners, knowing that local emergency management organization. I know Jerry was here earlier from the local office and had to go, but that really is important. And at the end of the day, we're all going to be working together, but that gets complicated the bigger the event gets. You want to take this? Yeah. So what they're really looking for is kind of a prioritization of your calls, you know. And so look at your system, or look at your organization logically. You know, what do we use every day? We use phones, over-reliant probably on cell phones, and we use a multitude of communication systems. More and more we're using WATRAC and finding out how helpful it is for that situational awareness and common operational picture, which is, you know, in our wonderful world of acronyms, you might see as SACOP. So situational awareness, common operational picture. But really in the big event, WATRAC is a really good tool for that purpose. But there are certainly other ways. You know, the news is pretty darn good. For those of us in Spokane, I'm continually amazed at how quickly KHQ beats CNN for even national headlines with their news alerts if you sign up for those things. So, you know, think about how you get your information as it affects the facility and the organization that you're in, and then have alternatives. So in hospitals, some have sat phones, some don't. Every hospital in the state years ago was outfitted with amateur radio. Some of those work more effectively than others. We've got kind of a bit of a renewed push. The thing that I often overlook is the integration and use with amateur radio operators. You'll hear as Aries Races, and those are really just the groups that those fantastic volunteers belong to, but they work every single time. It's a very simple and kind of, you know, we might say crude in our technology led days today, but it's really effective. And they're always willing to help. They're kind of pushing, you know, getting a little progressive with the things they can do, but especially for hospitals, but even communities, when our systems are down, they provide great situational awareness. And that's the ham radios as we've got listed here. Fax machines, I'm still kind of amazed in the hospital that we use them, but oh, holy cow, we use them a lot still, even though I can't really imagine when I ever would. And then really in an event that where we've lost everything, you know, whether it's runner or whether it's assistant, you can't overlook the need to have people to just take information from point A to point B, or to capture information. So, you know, that's really all things communication, and there's probably a bit more as well.
Yeah, absolutely. And so as you look at your facility, start to think, well, what communications would we use normally? What is their backup? Try not to reinvent the wheel here. Like Daryl was saying, we use our digital phone system all the time. We use email all the time. We use cell phone all the time. But sort of figure out what the tiers are, and in what circumstances would you start to really scrape the bottom and, you know, resort to fax machines or the satellite phone at 80 cents a minute, and kind of figure that out for your agency. And it would be a little different for each agency.
One minor comment too, looking at that chart. So 700 and 800 megahertz, everybody might not be familiar with. Idaho is on a statewide 700 megahertz system, which is great. They took a statewide approach to this a number of years ago. Spokane County uses 800 megahertz. Ironically, the hospitals are not on that system. And that was by design initially, and we're gradually trying to work our way there. Ed mentioned earlier the SkyFest this weekend. So one of the things that we've done with hospitals, and Ken, don't let me forget to ask if you want one, but Spokane Fire has given us a cache of radios, the 800 megahertz, for SkyFest this weekend, just as a contingency. If something happens, wouldn't it be nice that we had that situational awareness? So we're going to have some of those to utilize and distribute to our area hospitals. Probably won't be used, but if something happens, it'll be nice to hand those out.
Yeah, and that's actually a great point, Daryl, and it kind of goes into what Travis was saying about political boundaries. So State of Idaho has 700 megahertz radios. We have one in our Security Operations Center and one in our ED that are on all the time that we can listen to. We get ambulance traffic through them. And we actually have the ability to switch onto the 800 megahertz system. So if a big event happened in Spokane, all we have to do is call Boise to call Olympia to get us access to Spokane. So, you know, start working through these things in your mind, and what would it take to have these sort of communication capabilities. You know, a couple other things for communication requirements, methods for sharing information with other healthcare providers. Again, that goes to the chart that you guys just saw. That's sort of the how. And then the next piece of that is, operationalizing it. So within your communications plan, say these are the circumstances in which we would share information with other healthcare providers, and this is how we would do it. And most of your agencies do it, on a day-to-day basis. Anyway, when you transfer patients between hospitals or from like a long-term care facility to a hospital. A means to release information during an evacuation is crucial. My hospital census today was at 234. So if I had to release information during an evacuation on, the patients and where they went, that's 234 different people with unique medical records that would have to go out to each of the alternate care sites. Able to provide information about patients under the facility's care. That kind of goes into our public information officer role. If you guys have a marketing and communications department, great. And if not, you really need to figure out some sort of method on here's how we would provide information. And then ability to provide occupancy needs and abilities. And that's really going back to how great WATRAC is. So if you have an event where, hey, the power is out, you can put that on WATRAC and let people know the power is out. If you're lucky like we are and you have a generator system, you can do it on your regular computers. If not, you can do it on your cell phone, which is great. Did I nail that one? All right.
Yeah, so what we tried to capture here is just some of the kind of primary capabilities that the hospitals in the area had. It's certainly not listing all the hospitals. Ultimately, we'll build this out a little bit more. I certainly tracked the Providence and St. Luke's one, so the 3 in Spokane, the 2 up in Stevens County. But it's nice to know what systems are monitored, and that's kind of what's depicted by the green color. Those that are not, and where you've got some backup power or you don't have backup power. I think following the windstorm in the fall of 2015, a lot of organizations kind of rethought that whole backup power requirement. Hospitals have it, or some hospitals do. And then satellite phone systems as well. Who has them, who doesn't. We used to do a bit of satellite phone testing. We don't do that as much anymore. But if you do have these systems, that's the other really important thing is, use them on a regular basis. Otherwise, at time of event, you may have difficulty finding them, or more problematic, you might have problems operating.
And this one was a real eye-opener to me. Beyond just these 3 types of communications, we had, I think, 8 or 9 different communication strategies. So ham radio would be one of them. And looking at it, I thought, well, maybe when we look at every single communications platform that hospitals have, there'd be one that's on emergency power and monitored 24 hours a day. Ends up it's not. We're all over the board. But I think that this is a really good starting point to say, here's the best way to contact this facility. And, it's something as simple as you could put a WATRAC notice out saying your hospital command center phone, have somebody go monitor it. And then guess what? The entire column turns green. So this has been a really interesting tool, and I'm hoping to have this expanding throughout our region. So MCI communications, so mass casualty incident communications. We had a work group last week or the week before that wanted to sort of hammer down how are we going to communicate during an MCI. And there was a lot of really good conversation around this. So basically what we sort of figured out is the incident happens, and whatever that incident is, and then we send out the alert via established networks to hospitals and agencies. So the established networks can be the HEAR radio, it can be a phone call. If it's very exclusively in Idaho, it could be the 700 system. And then once we know that, we communicate using established process and really go into the WATRAC command center chat room function. Who here has a WATRAC account? Just show of hands. Oh wow, you guys got some work to do for WATRAC accounts. So we're hoping that we get more and more people onto this system so we can really share the essential elements of information and really let people know what's happening during an incident. Sorry?
Yeah,
that's a great point.
Yeah, it's not limited to hospitals, and I was going to kind of comment on that on the next slide. Whoops, one too far. No, one more. Oops, other way. Sorry. Yeah, that one. Okay. So WATRAC, I still kind of struggle with this as my understanding and use and familiarity of it has grown. But WatchTrack, especially for hospitals and our staff, has been a really good alerting tool. It's been a good tool for situational awareness and that common operational picture, sharing of information. We're going to use it this weekend during SkyFest. At least our hospitals were. Our pre-hospitals providers are also on it, as well as dispatch centers. So it's just a nice platform to communicate. For some of the other suppliers and providers, which I know a lot are represented here in the room, certainly consider if it will work for you. Maybe try it out. It's not the perfect solution by any means. What I've learned is there really is not a perfect solution out there, unfortunately. And so just like, public information officers or communication experts tell you, to really get good penetration of a message, I think it's like 6 or 7 ways you have to do it and repeat it and see it via different devices. WatchTrack is just one of many that we do use, but it is working very well for us in our region. It's been growing and expanding, and so that's certainly something I think we'll continue to promote and push.
Yeah, and then with that, one of the big advantages to WatchTrack is it's a chat room. Everything's there. It's timestamped. It can be pre-established. So we had one for Hoop Fest. Luckily, we didn't have to use it, but it was there. It existed if we needed to log on. And that way, if you come to the incident, a day or two after the start of the incident, you can see the entire chat record of everything that's happened, and you can get really quick situational awareness with WatchTrack.
So hopefully this slide is, familiar to most everybody. Certainly, taking a foundation training of NIMS and ICS is really important so that we're all speaking the same language. But what we wanted to touch on here, just very briefly, as it relates to the communication piece, is a recognition to identify where that communication might be. And so, in any incident, there truly is, regardless of the size of the organization, only one position that has to be established. What do you think that position is? What position? Incident commander. Yeah, and even in our hospitals, in an incident that might be complex, we may only have an incident commander identified. Now, in the hospitals, what I'm learning more and more is this is not terminology that they're familiar with. So in hospitals, we call them house supervisors or administrative supervisors. So for the suppliers and providers, who might be the incident commander on any given day? And I know there's a bunch of different ones out here, but who is that? Not hospitals. Good question. No, I'm talking other suppliers and providers. So you're a long-term care center, an urgent care. Yeah, the administrator. Thank you. Yeah, they really are it, or the manager or the supervisor that's there. Maybe designated by the administrator potentially. And so that's the only position that has to be established. So if you've got a disaster going on and you've got communication requirements happening, the incident commander wears all the hats and has all the responsibilities until that position is delegated to someone else. So there's a number of different ways that can be done. It could be done as a liaison to the incident commander, and not to get into kind of an ICS organizational training class, but you've got command staff and general staff in the lower half. But it could also be under some of those other positions down below. But really the important point from a communication standpoint is that you designate someone to do that, to coordinate with other agencies and organizations. And it might also be that public information officer who, oh, by the way, might also be the incident commander, the administrator, the house supervisor, or the administrator on call or something like that. So again, kind of the blessing and the curse of emergency management and ICS is you can do it however you want to. But there are some good processes and templates established out there, but just think about these things pre-event so that after the incident, you can, quickly respond, life safety first, and then start establishing the support that's required for that incident.
Great. So any questions, first off, and then I've got a couple questions for you. No questions? did that good of a job. So who here has communications plan for their facility? Show of hands, few of you. The nice thing is, as part of our ongoing efforts, I have this policy where no matter what I create, I will share it with whoever wants to take it, edit, plagiarize it, whatever you want to do. And so we have the Kootenai Health draft, I guess, communications plan, and Dean has also given the Multicare Deaconess communication plan, and they're available.
/ACC.
They're available online. So please take a look at those. They really pass accreditation requirements. I've had a couple successful Joint Commissioner surveys so far. So if you need a place to start, this is a really good place to start, and they're completely available. Feel free to email me, email Dean if you have any questions. Oh, copies in the back too.
Yeah, and then really think back that slide that Ed showed that lined up some of the projects that the Healthcare Coalition has worked on or supported. Some of those through the years, those really do fit very nicely into the communication strategy. It is important to customize one for your organization. That's probably not going to stand alone on a regulatory visit, but that really is an important piece of it.
Yeah, that's a great point on the customizing your plan. So don't just copy paste it, because mine says Kootenai Health all over the place. Try not to do that. Any other questions?
It's happened.
Oh, it has. I've seen it before. So. Any other questions?
Just kind of embarrassing.
All right, thanks, guys.
So this is the exciting thing about our region is we have technical expertise out there that is abounding, and some very smart people that help us do our work. And they, as Ken said, they're more than willing to share that work to our advantage. And as Travis mentioned, both of those plans that were referenced, there are copies on the back if you want to grab those on your way out to help you with your own communications plan. But we're going to step into our work groups here in a minute to further discuss communications plan, but we're going to take a step back on our chart to step forward, and I'll see if I can confuse the heck out of you. The other piece that we didn't get to on the chart of the CMS requirements that we've all talked about and you have all expressed interest in is around the exercise component. And we have our savior. Casey's going to talk to us about the work that he's doing around that exercise component and how it may or may not help you with your needs.